On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block in Washington, D.C. at the ACC annual meeting for On the Scene. Recurrent pericarditis has been a chronic issue, no pun intended, and dealing with it and treating it has been a terrible problem for any cardiologist. With me is Massimo Amasio from Torino, Italy. Massimo, you've done a wonderful trial concerning how to treat pericarditis. Tell me about the trial.
In this trial, we randomized patients to receive colchicine or placebo on top of standard anti-inflammatory therapy, and to see if colchicine may be useful and safe to prevent recurrences of pericarditis in patients who already have multiple recurrences of pericarditis.
So this is recurrent pericarditis. Now, when you say standard therapy, does that include prednisone and salicylates and so forth, or what was standard therapy, and was that just a choice?
Okay, the standard therapy, the first choice was aspirin or another non-steroidal anti-inflammatory drug. In the trial we used ibuprofen and indomethacin, and the investigators were free to make the best selection because according to available evidence, we have no evidence that one drug is superior to the other. Corticosteroids should be used as last resort, so only for patients who are not responsive to these drugs. And colchicine was added on top of this standard therapy, generally aspirin or ibuprofen or sometimes indomethacin, and very rarely prednisone.
Okay, so I guess the next question is, what did you find? Because this is an exciting trial.
Yes, the recurrent pericarditis is the main problem from a physician managing patients with pericarditis because it recurs in about 1/3 of cases after a first episode, but even in up to 50% of patients who had already one recurrence. So to prevent and to treat recurrences is the major problem. So in this trial we demonstrated that colchicine added on top of standard therapy is safe and efficacious to halve the incidence of further recurrences. So the drug is very, very safe and useful also and efficacious to prevent recurrent pericarditis.
When I was looking at the data, there was a 50% reduction in recurrences. Is that correct?
Yes, you are right, and we were very impressed to see that this effort is consistent with all the previous experience, because colchicine is able to halve the incidence of recurrences of pericarditis after first episode. The trial was presented last year and published in the New England Journal of Medicine, and also in the first recurrence, the Corp trial, the number 1, that was published in 2011 on the Annals of Internal Medicine, and now in this trial, patient with 2 or more recurrences, the most tricky and most difficult patient even is able to have the incidence of recurrences.
So I guess I should ask you what the take-home message is, but tell me, if I had pericarditis as an initial presentation, would you start colchicine the first time around?
Well, I think we have now enough evidence coming from different clinical trials. We have at least 3 multicentral randomized double-blind clinical trials on acute pericarditis, first recurrence and multiple recurrences, showing that the drug, if you have no contraindication or no specific indication, the drug should be the first choice to be used and should be added on top of standard anti-inflammatory therapy.
So there you have it, folks. Colchicine for pericarditis seems to be the way to take care of things, even for recurrences. Thank you very much, Mr.
Just one additional thing, the paper is published today on the Lancet, and so those who are interested to have an in-depth view to the trial can see the full publication today.
Thank you, Massimo.